Hi guys, welcome to this week's video. I've been thinking of doing this for a while because it's now 2 years since my total hip excision or total hip arthroplasty, or Schoenecker procedure is the variant I apparently had, or something approaching a Schoenecker procedure was what one surgeon said it was. But some people have something similar called a girdle stone or a castle procedure. So that's several names for it, and I'm going to attempt to show you what they do with some slides, but I need to explain the background to my issues that resulted in my needing a hip excision procedure in the first place. As most of you who watch me regularly know, I have cerebral palsy. Specifically, I think you would say spastic diplegia or level 3 cerebral palsy. I've been told. I am wheelchair dependent full time, and I am unable to transfer myself from chair to bed to shower and that kind of thing. However, up until 2020, I was a full-time wheelchair user, but I was still able to transfer from one surface to another, and I could get in and out of a normal car using a sort of pivot transfer or just a slide transfer, but without the use of one of those transfer boards that frankly petrify me. The less said about my experiences with those, probably the better. I was originally diagnosed with cerebral palsy at the age of 2 years old. I had failed to meet developmental milestones. I couldn't do things like sit, roll over, or crawl, or any of the things that one would expect a baby or toddler to do. However, I eventually learned to walk, first with a rollator type, a front-facing rollator type device, followed by tripod sticks, and then I went to walking independently with cane type things briefly in between those two steps, but me and walking sticks never got on particularly well because I am utterly uncoordinated. Even for someone with CP, I was, or at least with my level of CP, or what was considered to be my level at the time, I was vastly uncoordinated. So I kind of preferred to just kind of hurl myself at like life. I used to kind of walk between one object and another, or frequently fall over, and that kind of thing. So I did that from about the age of 5, and by the time I was 13, I was starting to have sort of hip and knee related problems. My left knee was quite sort of internally rotated, and my hip wasn't properly in its socket, so I had quite a major operation where they broke my leg top and bottom in about 4 different places, and then they screwed me back together with metal plates, which was very painful at the time. And what I experienced after, I wish I had I wish I had listened to that experience, because in some ways it foreshadowed what was to happen later. But I kind of expected the surgeon that took me on to have thought about this issue, but I don't think he did. But I had my surgery anyway, and although I had spasticity present in my limbs, I'd never really had intense, or not that I could recall as a child, intense spasm type pain where I couldn't sort of control my muscles. The only time I had experienced that kind of thing was when it was very cold, like in the winters. Back when I was born, you still frequently had quite a lot of snow in the winter, and it was quite icy. I mean, British winters can be quite cold, and back then we didn't have central heating. So if I was cold, or for some reason was put in cold water, or like just a normal standard swimming pool, my muscles would tense up. That was the only experience I had of my muscles involuntarily tensing up and like in relation to pain or discomfort. But after I had my femoral and tibial osteotomy, I think it was called, the reactive spasticity and related to pain was very much off the charts, so much that they had to splint my leg, even though they would normally not have done so, because it was in danger of not healing in the appropriate orientation if they hadn't. And also because I went to special school at the time, we had a hydrotherapy pool, and we had physiotherapists who were based at the school as well, so I had quite a lot of physiotherapy back then, over about a 12-18 month period. And even the physio in the community, when I got discharged from paediatric services at 16, they had better access. They had a hydro pool in the local hospital, which they don't now. So I managed to get back to walking. However, because I no longer had access to weekly physiotherapy and assistance that way, and I had moved on to complete or to retake 2 years of high school, I sort of concentrated on that, and I only got back to walking really with crutches from that point. In the house I could do a few steps here and there between things, but I couldn't carry an object or something like that, or functionally do much. So basically I've lost my ability to walk unaided outside on an uneven surface. I just wasn't safe, and I'd lost an awful lot of confidence, and I think because I was very late into puberty as well, I suddenly developed a very different figure, and I kind of lost my centre of balance in that way, because female bodies change a lot. But I was fairly okay. I was still very much independent, and even when I had to use a wheelchair and crutches outside, I could still more or less cope, as it were. I had several falls, and this is where the problems with the hip that I got operated on 3 years ago start. When I was having to do more walking because I was mainstreamed in education, I would be walking along and suddenly my right hip would come completely or partly sublux out of socket, and I would hit the floor. Occasionally we could get it to go back in, and I think once we ended up at the hospital, but they were slightly perplexed as to what to do with me, which has happened a few times since, because adult orthopaedic surgeons are not that conversant, at least in general orthopaedic practice, with adult cerebral palsy patients. So this went on. I did seek an orthopaedic opinion after this had happened, and his words to me was that he would worry about the situation if I was 3 years old. I wasn't 3 years old. Go away, use your wheelchair and enjoy life was more or less what he said. And then that would be the answer to the pain stopping. So I kind of wasn't that struck on that I like using a wheelchair all the time. So I carried on walking for about another 18 months, 2 years perhaps. I walked until I collapsed in the street and was having great pain in both my lower back and hip that was subluxed, and I then became a full-time wheelchair user. By that point I was 21 and at university. I had a few interventions in between to try and lessen problems with spasticity and spasms. I had an intrathecal baclofen pump, which briefly got me back on my feet, at least from a therapeutic walking standpoint. I could do like go up and down a straight surface, like a corridor at the apartments where I lived, or my mum and dad's living room. But I couldn't like walk around the house and actually do anything without somebody present to make sure I didn't fall over. But the hip wasn't bothering me too much until I would say about 2012-14, it started to intermittently cause quite significant pain, and I was at a loss of what to do. I'd had painkillers from the doctor, and the doctor at one point was convinced that maybe the bone had died, like the actual bone itself, because I've also got a history of chronic osteomyelitis, but it hadn't, and there wasn't a recurrence of that. So we then started to seek an opinion about what was to be done with the hip, because it was becoming so painful, and I was losing my independence, like to be able to transfer and to do things. I had to give up my PhD in Sussex because I couldn't physically be on my own, and I hadn't got carers at that point, and it didn't look like I was going to get that level of care if I did qualify to have carers. And then COVID hit, and I had seen a few surgeons before this, and they were very much, one said it wasn't acceptable to do nothing, but he wasn't quite sure about what to do for the best. So basically, one surgeon would pass me on to another surgeon, would pass me on to another surgeon, and this went on for about 3 years. And then and we had actually done a full circle of surgeons by the time COVID had hit, and I was back with the original surgeon that I had been referred to. And then COVID had hit, and he'd done some more extensive testing that showed exactly the same as the previous testing, that the hip was subluxed and arthritic, and that I probably wasn't a candidate for a hip replacement because of the level of spasticity I had. I wasn't, if I'd have had a hip replacement or a hip prosthetic, it would in all probability have spontaneously come out of socket like my natural hip had done. So once COVID had hit its height and then was calming down and they reopened elective surgery, the surgeon that had kind of been, I'd ended up back under his care again because effectively no one would take any risk. And then I'd got to the point where I was sick of going to appointments, and I'd said, I literally said to Dad, if this time they say they're not going to do anything, that's it. We give up and we just carry on as we are. And also by this point I had got sores in my groin and I think a small sore on my coccyx as well, because I was having to spend more time in bed. But in between the COVID lockdown in the UK and seeing the surgeon that I was back seeing again, he had been talking to a colleague and they had decided to do this modified procedure and take the hip. They literally, I'll show you in the diagram, if this is the ball and that is the socket, they literally take the ball off the end of your leg and then they kind of wind the muscle round it and pack it in place. I think that, or at least that's what I remember the explanation of being. I've got, I think, some slightly better diagrams to explain it, which I will have hopefully put in the video while I'm talking to you, if I can work out how to do that. So I decide that yes, finally I will go ahead with the surgery, because not having a gap between your legs when you are female is quite sort of problematic in terms of cleaning, for one thing, and for anybody it is difficult because your skin rubs and it doesn't get the right air to it, and it becomes very vulnerable to pressure issues and infection and things. And I was starting to have that problem. One area of my groin used to smell to me like almost like a mouldy shower. If you go somewhere where there's a communal shower and you get that sort of vague mouldy smell, that was emanating from one part of my groin at one point. So this is what I wanted to stop. And I was hoping that it would loosen all my muscles up and I would feel overall better. I've always had a dream of having much more of a gap between my legs because at one point when I was younger, I used to be able to ride horses when I was having constant physio and things. But I hadn't been able to do that for many, many years, and I think somewhere deep in my soul I had wanted to get back to horse riding and swimming and being more active, and I wanted to try and regain my independence because it was rapidly going down the tube. So on the 31st of November, I underwent a very long procedure, and I will talk you through what happened and show you a few pictures. This is a quick sketch that shows the abnormal angle of my hip to start with. This is a representation of the stages my hip went through to get me to the point of needing surgery. This video has become quite long, so I've decided to turn it into a two-parter because it's over 20 minutes now with just the explanation of how I came to go into my surgery in the first place. So I'm going to do two parts, and this will be what happened when I went into surgery and the recovery period afterwards. So if you've enjoyed this video and found it informative, please feel free to like and subscribe, and I'll see you in part 2 of this video.